Our next guest says, for most of my career, I worked in nonprofits, but when I looked around, I realized something. Hard, the most vulnerable people in this country don't just need more missions, they need better business built to serve them. Michael, I mean, what a strong statement to actually mention the first time that we actually get on. After 25 years, man, in this nonprofit health systems, what made you step into the for-profit world and why? Why do you felt that was just the change and need that was you're looking for?
Yeah, and initially it was probably different than where it ended up. For me professionally, wanted to try something more entrepreneurial, a little different. What I came to find out for this world that I'm leading now is I'm in a very fragmented industry, a lot of very small kind of mom and pop businesses, and really an opportunity to hopefully professionalize the services that we can provide to vulnerable populations, scale, bring technology to the forefront, maybe a little more sophistication, and partner with a lot of these small businesses to kind of pull them together. And here we are 8 years later, and that's very much been our story, and it's been absolutely awesome.
Listen, I'm a big believer there's something to learn from every part of your life. What did you learn about Philly's nonprofit world that still drives how you're even leading today with the organization that you're running?
Yeah, I think healthcare in general. I've always really appreciated a couple things. One, the mission around it, right? All of any business associated with healthcare ultimately exists to help people, and that's always been something that's resonated with me. My mother worked in healthcare most of her career, so I got to see that a little bit. But the other thing that I really appreciate is the diversity of people that I get to interact with on a daily basis. So whether that was in the hospital, where it could be, an orthopedic surgeon, a family who's delivering their first baby, a single mom who's an employee of ours who happens to be working in, environmental services, or a nurse, and all the families that come in at moments of excitement and joy, but also, real times of need. So that diversity of folks that I got to come in contact with and still do is one of the most important things that drives me.
Tell us a little bit about your organization. What are you doing currently today? A little bit about where it got started, where you're located, for those that are listening and may not know.
Sure. So Amivie, we were formerly known as community-based care. We were founded in 2015, and I started shortly after that. The company was initially founded with the premise of serving individuals in the state of North Carolina who have an intellectual and developmental disability, but to serve them in their home, which, again, that's kind of become the story of our company. We're looking to serve folks in their home to try to meet all of their needs. So at that point, we were serving that specific population in that specific market. We started off with about 300 individuals we were serving, and we have grown to, we're now serving over 8,000 individuals, employ about 8,000 folks across 5 states, and largely doing the exact same thing, but for broader populations. So we're the provider who provides that one-on-one support in the home, from everything from helping seniors age in place, to seniors with a physical disability, to behavioral needs, or intellectual and developmental disabilities. And the thing that the team does really, really well is we've gotten really good at matching the perfect caregiver with the client. And once we get that match made, we have clients we're serving for decades. So these are all kind of long-term relationships.
You mentioned at-home care. Why is home care both the most affordable and the most human option, and yet so overlooked?
Well, I think it's becoming less overlooked literally every day, particularly as budget pressures mount. We're a Medicaid. Medicaid is basically our payer, so we serve primarily a Medicaid population, and it's certainly the least expensive venue of care. So, we talk to our constituents all the time around. We can care for anywhere from 5 to 10 individuals at home for the same budget dollar from a state perspective that can care for one in a hospital, a nursing home, a group home. And we hear all the time, this is what families prefer. I mean, I too was a customer of in-home care with my father, needing someone to kind of be there when I couldn't. And that peace of mind that it provides families is priceless, right? So, and we're working all the time around how do we continue to build our services to keep people in their homes where they want to be.
This is what you're doing today, Michael. Did you always want to do this? Like, what was the vision that Michael wanted to do as he was getting out of college or getting out of high school? Was it always to be in the healthcare space, or did he want to do something else?
I would love to give you some like amazing inspirational story. The reality is when I graduated college, I needed a job. I had some good connections with a hospital system down the road. I was working as a waiter, and the owner of our restaurant happened to be on the board. So he introduced me. I did a summer internship right out of college, and completely fell in love with it for all the reasons I just mentioned.
Yeah.
There's so many walks of life that you interact with. From in healthcare delivery, and I'm an administrator. I'm not a clinician. I don't deliver care, but I take a lot of pride in being able to give the folks that work with us really rewarding careers, hopefully recognize the amazing work they do, because particularly in this field, our caregivers, these are, they're not in it for the money. They're in it for the
Yeah.
mission. And I'm really proud of what our teams do. I was proud of it at the hospital. And I get to go home every day feeling like we did something good. And maybe I didn't put my hands on it directly, but our reach has been growing and growing with Amivie. But that's really been the thing that's been the most rewarding over my career. And now I couldn't think of doing anything else.
I mean, I love the story, right? You're working at, you said, at a restaurant, and the owner happened to be on the board. Like, the way that life that you just explained that's how it usually happens. You just
Yeah.
never know, and you tell your story, you tell people what it is that you want to do, and people are listening. And that's why it's always very important that you just not tell everybody your dream, but tell those right people, because they will open doors that you never even knew were available to you. And here you are today, man, years later.
100%. If you would have asked me then when I needed a job, if I would be doing this for 33 years, I would have said there's no way, because at whatever 22, you don't know any different. But honestly, I couldn't think of doing anything else.
And now, man, you're in the space of scaling this industry built by mom and pop operators. How do you preserve Hart while still growing so many locations?
Yeah, I mean, I like to think we do it a little differently. We consider ourselves a family of providers. That's how we've kind of built this company, and that's all the legacy, small family-owned businesses that have come together. And what I tell every owner when we have conversations about joining the family, someone looking to sell their company, in addition to, number one, we're going to do a really good job. We have a team of caregivers and support center staff that are entirely committed to making sure we provide the best service, highest quality along the way. But I talk to every seller about, like, I take very seriously the responsibility of carrying on their legacy. Because for a lot of these small business owners, they've gotten to the point where they've grown their business beyond what they ever expected.
Yeah.
And typically they're faced with decisions like, do I invest in technology? How do I have to look at employee benefits differently? And these are personal decisions for them because they're a single owner. So I take very seriously that responsibility. They've created this family of caregivers and clients that they serve, families that they support. And first and foremost, we want to continue that. And I'm really proud of the results that, we have retained through all of those acquisitions well over 90% of their employees and caregivers in every single case. And I love just, having, as we're talking to different, potential partners, to go talk to any of those 48. Because one of the things that's really important to me, and hope I think this filters down through the organization. We are who we are. We say what we're going to do. We don't say there's not going to be any change, because that would be pretty naive. And hopefully we have a really good track record of doing what we say and telling them what we're going to do, and that goes a long way.
Yeah, man. You mentioned a lot of times owners asking themselves, do they invest into the right technology? Is there technology that you felt that you've implemented that are really help scale, or is there anything on the horizon that you feel could definitely continue to help move the needle that you guys are under right now?
Yeah, I mean, in 2021 we were at our own inflection point around. We had, as I mentioned, we started with 300 clients, so we had technology that could, get us to the point of maybe 1,500 clients or so, and that's how we measure growth. How many people are we impacting and serving?
Yeah.
And for us, it was a decision. strategically, how far do we want to grow, and making sure that we have scalable systems that can get us there. And those are really significant investments. And we are still kind of growing into our shoes. For small businesses, they're not typically going to consider the kinds of systems we are, but they're also really significant investments. And it takes talent around those investments to ensure that you're optimally using the technology, because anybody can buy a system off the shelf. I think the last statistic I saw, most electronic health records are utilized 30% of what they're capable of doing.
Yeah.
And in 2021, 2022, we implemented every system we have in place now. We kind of slowed our growth to get our footing under us, and that's a human capital management system, financial system, electronic health record, recruiting system. All of that is pretty new to us.
I didn't hear you say anything about AI, Michael. We're in the space of AI. Are you guys seeing that that's worthy what you guys are doing? Do you feel like it's not needed? I mean, I think about the side, you talk about administration, really on the administration side, where we can do things, more of the things that we like, but we can automate and we can use AI to do the things that we don't like, the things that we didn't go to school for, that doesn't interest us as much.
Yeah.
Are you guys in that space?
We are starting to explore opportunities for AI, but honestly, we haven't implemented anything yet. There's a fair amount of application, I think, in the services we provide. A fair amount of what we do is very transactional in nature. Whether that's kind of the early stages of recruiting, filtering through 6,000 job applications, or we have different service authorization processes across the different markets that we're in. Some of those things definitely have application for AI. Where we've used it kind of immediately is just in the way we operate. We're a remote business. We have employees across 20 different states, and using very simple AI tools like Gemini note taking really goes a long way to help keep people on the same page. But I do think there's definitely opportunities for us in the future, but we're just at the infancy of how we can utilize it with our systems.
I know you mentioned Medicaid a little earlier, that you guys kind of work around this Medicaid model, but do you think that it's going to be impactful now with all the government cuts? Like, are you feeling it now? Is that something that you guys even worried about? I kind of imagine that you already looked ahead at those type of options.
Yeah, I mean, with the federal OBBBA bill, for the services we provide, there's not really any direct impacts of that bill on the services we provide. That being said, where the challenges that we expect we'll have to navigate in the future will come in is how it impacts state budgets, because ultimately our services are funded state by state. So we look to have a diversity of different markets, so we're not kind of overloaded in one particular state if something should go the way we don't want it to. So that's something I'm sure will have at least a near-term impact as states try to figure out their own impact on kind of federal matching for Medicaid. All that being said, I mean, the argument that we will continue to make, and I think what every state Medicaid office understands, and most legislators understand, we are still the lowest cost. We are cost savings, the services we provide, because we're still the lowest cost of care across the continuum from home all the way up to institutions. And it really enables us to continue the message around, hey, if anything, continue to invest in these services for the potential of long-term savings in some of those other settings. So it certainly creates some noise now. But to be perfectly honest, there's always some level of noise when it comes to the regulatory or reimbursement framework. And we try not to overreact to any one of those things. For this business, and this is one of the things I appreciate most about what we're doing, at the end of the day, if we take really good care of our clients, are responsive to the needs of the families, and take really good care of our employees, the rest of it honestly takes care of itself. And that's where we try to keep our focus.
Just listening to you and the way that you navigate some of these questions, the way you respond to them, I could tell that you're just an amazing leader. Where does some of this leadership come from? Is it something that was poured into you? Was it just life experiences? Like, someone has to pour into Michael, right? Where are you learning all this?
Honestly, I just try to listen to every interaction I have. I try to watch, people in leadership roles. I've worked with some really good and some really bad, with and for some really good and really bad leaders, and I like to think along the way I've learned from each and every one of them. Certainly my parents in different ways have been leaders that's helped kind of form who I am. But as much as anything else, I just, try to be present and pay attention. And there's almost no conversation that I'm part of, or, if I'm watching somebody speak, then I'm not saying to myself, I would want to do that, or I wouldn't want to do that. And it's the biggest, I guess, factor in my developmental leader has been failing. It's really important for any leader to fail, learn from it, and survive and come out the other side. And I always say this, and I've said this in every leadership role I've been in. I have 3 daughters. Any one of them could do my job in any situation where things are going well. Where you really find out kind of how folks respond is when times are tough. And and I learned kind of early on, and I think raising daughters is a great teacher to this, to try to maintain a certain level of not getting too high, not getting too low, because as a leader, everybody looks at how you respond, and they're going to take a position based on that. So I try to always remember that, and I will never feel like I'm who I want to be, but I try to, take all those lessons. And some of it is, formal kind of coaching and things like that.
Yeah.
But experience I think is by far the best teacher.
If the Hart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure you guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. Experience is everything, man. I always say experience will teach you more than school ever will.
100%.
And I used to get so mad at the level of, I was a general manager at 19 years old, and you had someone that comes with a 4-year degree, but I'm running circles around this person. However, that piece of paper always got them the job, right? But I'm like, you can't teach what I know. This person. So I wanted to kind of go back to something else you mentioned. I remember I was 19 probably years old, or maybe even younger. Maybe I was 18. And that director of operations comes into the store. Mind you, I'm this 18, 19-year-old boy, very young, thinking he knew it all. There was no manager, so I'm like day in, day out. Like, that's just my work ethic. Like, I was there, I was knocking it out. And I remember I'm doing all the inventory, all the ordering, everything that you can think of, I'm doing it. And I remember him showing up one night, and there was a mess in the store. But I was there by myself. Nobody helped me all day. So, of course, I'm livid at this point, right? And he comes in and he's saying, Ephraim, what is wrong here was this. And I'm just spazzing out on him saying, what do you mean? Like, I've been here doing this. I've done the food truck order. I've done this. He says, Ephraim, anybody can do it, but is it done right? I got so mad, but it was so real, kind of to what you just said, right? Mm-hmm. Anybody can do it when it's good, Ephraim. Yeah. But is it being done right at the end of the day? Are you actually leading, or are you just doing it? Mm-hmm. And I would never forget, man. So I've had a lot of leaders that I could remember what they said. Anybody come to mind, top of your head, wife, old friend, old coworker, just that one thing that resonates with you that you still hold on that somebody said to you?
There's so many that come to mind. One mentor of mine, Carolyn Hines, we used her a few times as a consultant. And, one of the most kind of profound things she ever said to me was really simple. And it was around if somebody's coming to you with a problem, it doesn't mean it's yours to solve. Right. And, wow. And one of the thing that I'm probably most proud of in my career is folks that I've worked with or have worked for me, seeing them ascend in their career. And I like to think I play, some small part in that. But her advice, and I was a young leader at the time, and this is, I try to follow this same logic at home with my wife and family. I'm not nearly as good at it because I always want to fix stuff. But her point was, you're letting them off the hook. And number 2, you're really not teaching them anything, right? What you're teaching them is to come to you when they have a problem and you'll fix it. And that was a little bit of a hard habit for me to break. But as I've been able to do that, I've really seen, as people have come with problems, I more respond with, okay, and what's your plan? Or if they, even worse, if they come talking about another member of the team, well, what did they say? Right? To really try to kind of redirect that energy. And it seems like a really simple thing, but it's also when you're used to kind of when my career was ascending, it felt like I always needed to solve a problem and do something and demonstrate my effectiveness. And what I've learned over time is that's probably even more effective than being the fixer or the problem solver.
That was a good one. That is true. I'm that guy. Anyone comes to me with a problem, trying to figure it out or find someone that may know it, and a lot of times that's just the wrong way to kind of go around that, man.
Yeah.
That's a really good lesson. So in the space of you growing, we talked about just the growth and what you guys have been able to do for the last couple of years. You also want to double the states. You're in 5 states now. Of course, 10 would be definitely where we want to be. But what is that biggest barrier and maybe the biggest unlock to actually making that jump from 5 to 10?
Well, I don't know if entering this. So there's 2 ways we grow, basically, well, 3 ways. One, is based on the existing book of business, growing organically, and we are growing probably twice as fast as the rest of the market, and that's because that's entirely. A little bit because of some of the support we provide from an infrastructure standpoint, but it's really putting our frontline supervisors, branch managers in a position to go win and recruit and have great relationships with our referral sources. So that's one leg. The second is in markets where we're in, we want to have a significant amount of density so that so that we're in a position to be able to have meaningful discussions with our state partners around the design of the system and rate structure and bureaucracy that flows around our services. And then the third leg is identifying the right markets to enter. And that's a little bit of science and a little bit of art. But if you look at the states we're in today, we're in Rhode Island, Minnesota, Virginia, North Carolina, and Ohio. And those 5 states, they have nothing necessarily in common other than the fact they're states that have demonstrated over time they're very supportive of in-home services through Medicaid, right? And that shows up in a variety of different ways. So not that it's a barrier to growth, but we are very deliberate about identifying state partners that are the right fit from that standpoint. I mean, we want to make sure that they have a rate structure in place that allows us to pay our caregivers what we deem are competitive, meaningful wages, and every state's a little different related to that. So that's one thing. And then I think just from a capacity standpoint, we've grown very quickly, and we want to continue to grow very quickly, and we don't want to sacrifice the culture to do it. So it's also there's a bit of making sure that we have the infrastructure, we have the technology in place on more the technical side of things, but that we're able to get out and still do that face-to-face touch with our constituents. I mean, I still try to meet every single incoming acquisition face-to-face in person. And some of those things I don't want us to sacrifice. So some of it's pace of growth, some of it's making sure we have the infrastructure, and the other is making sure that we enter the right markets.
I mean, no better leader to get this done than you. I mean, you've clearly done a phenomenal job, so you'll continue to scale, whether organically, strategically. I can imagine that you guys get to 10 locations. When you think 10 locations, how long do you think that would take you? Year, 5 years? You got to speak into existence, Michael. I'm a big believer in speaking to existence.
Yeah,
So.
I think 10 is within 3 years, and I think we're probably halfway there within a year.
Oh man, I love this. I love this.
And to be, and it's not just to put a flag on the map. It's to, when we enter a market, it's the beginning. So, we entered Minnesota in April of 2024 with one partner. We're now up to 5 there. So that's really it's enter a market and then try to build relationships to expand within that market and then become meaningful. And that's, again, as we start to talk to some of our constituents, we're helping professionalize that, and there's, as we think about innovative ways to expand the services that we can provide, you really kind of need some scale to be sitting at the table for that.
I love this, man. And what listeners should know is, whether they know it or not, everyone's going to need this kind of care, or provide it, to be quite frank. What should they be thinking about right now?
Well, it's hard to think about it until you need it, unfortunately. I mean, in some cases, and that's probably more the case in our senior population. For the folks we serve who happen to have an intellectual or developmental disability, it's a little different. I mean, those families, and that's about half of the families we serve, they have been advocating for what becomes our client for their whole life. From birth. So it kind of raises the bar for us to be able to, jump in and earn their trust. But I think the thing for families to recognize, I've worked in pretty much every venue of healthcare, from nursing homes to hospitals. We've had group homes, and there's no question in my mind the safest, most convenient, healthiest from a community and social integration standpoint is at home. And I think, as folks start to contemplate, the needs of their loved one, or personally themselves, just making sure, there's an understanding of the services, how they're available. The Medicaid system generally is very difficult to manage, and that's where folks like us come in to try to help folks navigate that. And for families who are looking for care like I needed care for my father, I didn't do anything until I needed it, and it's it's a race to catch up, and for a lot of our families, it's as simple as find me the right person who's going to reliably show up that I can trust, and those are the kind of caregivers we look for. We can train across the board on any of the technical skills and the needs specific to the client, but I couldn't be more proud of 8,000 caregivers we have out there, and the amazing things they do that are above and beyond every day. They talk about these things as ordinary kind of events in the course of what they do. To you and I, they're extraordinary. And these kinds of things are happening all the time, not just with Amivie, but in this profession as a whole. And I'd like to think we as a company cultivate that and bring out even more of that, the best of that in the caregivers.
I'd love to hear that number, man. 8,000, caregivers, because we also have kind of experienced for the last couple of years a decline in caregivers, right? Looks like you guys are still scaling up, bringing caregivers back to what they love the most, and a lot of it is the technology. A lot of it is helping them in a sense of doing more of what they love and less of the things that they don't. So I think that's where we're seeing a lot of increase when we're starting to implement those right things. And kudos to you, man, for even thinking beyond that and finding those people that have a passion, right, that purpose, and not just so much chasing that paycheck, because this line of work is not all about paychecks. It's about doing the things that you love, about helping others, and you guys are doing it quite well, man. If someone wants to support this model in the community, where do they start?
Well, if they want to join this model with Amivie, they can certainly go to amivie.com. We are always looking for not only caregivers, but for professionals as the organization grows. And I think, generally throughout the community, there's a lot of similar, providers. Caregiving it's a calling. Target's always hiring, Walmart's always hiring. That's not who we employ. The folks that we hire, they want to care for folks. And, and I certainly think there's a fair amount of them out there. And I think, there's given kind of my experience, I've seen a lot of cases where, I've seen caregivers, nurses, whoever transition from more of a facility, hospital setting into the home, not knowing what it's going to be. And it doesn't always work out, but many times it's just such a fulfilling experience because they're able to build what really is a long-term relationship with their client. And that opportunity doesn't exist in more of an episodic kind of acute or even home health setting. So that's one of the things that just makes it different. And it's not for everybody, but it's the thing for 8,000 folks at Amivie.
As we start to wrap this up, man, what's your biggest hope for how home-based care will look like in the next 10 years?
My biggest hope is that it's recognized for more than just companionship, right? Because I think in some folks view it as we're inherently a non-clinical service, But we're also the first eyes and ears. Our team is signaling when there's potential hazards in the home, potential, medications not working together well. There's a lot of talk about telemedicine. We are the manual telemedicine in the home. And our folks are able to pick up on things that ultimately prevent hospitalizations. Now, we haven't, and that's just as an example, we haven't gotten to the point where we can fully demonstrate that with data. But my hope for the industry is that it's recognized as a key part of the clinical continuum, even though inherently the work that our team does is not inherently clinical. But we are the eyes and ears. We're the first person family members call, and I know that, I know how important it is to the families because they advocate so much for their caregivers to stay with their loved one.
Yeah.
And we've been fortunate that we've been able to continually kind of increase wages over time, largely with support from our states, but to make it more of a career for a lot of our caregivers as opposed to, a job. But I think recognition along that continuum would be what I would hope for.
I just love that you're talking about growth and expansion and paying more because I've spoken to a lot of leaders and it's kind of quite the opposite, Michael. So clearly you are doing something amazing. And I just wish you nothing but success, right? That those locations, more states come even sooner than what you think. But I'll leave you with this blind question here, man. You spent your whole career trying to serve the underserved. What's one moment that made you question whether it's working and what kept you from walking away?
To be perfectly honest, I've never considered walking away. Never, have. That's one thing I don't know that I've ever done. That being said, it's when the pressures mount in things that truly cannot be controlled. Those are the most frustrating moments because I and our team has a very high bar around. We control 90% of the things that happens in this company, even if it's based on external influence. That being said, from time to time, we're dealing with a particular state's budget challenge now, and it's just creating turmoil that we have no control over, right? So, what we try to do is boil that down into what we can control, but I think it's not getting me considering walk away. But those are the most frustrating moments that. Everybody knows we're all trying to do the right thing. And, when political forces kind of get in the way and things like that, that becomes frustrating.
Yeah, a little challenging. Nah, you're right. And I think that's where we all are, right? That challenge of how do we continue to move forward. Now, I appreciate you, Michael. I really appreciate the conversation, just being so open and authentic. And guys, if you guys are asking yourselves, how do you get involved? What was the website did you mention, Michael, that they can go and figure out more information about this?
It's amivie.com.
And are you guys on social media?
We're
Instagram,
on,
Facebook?
all the socials are linked there. So we're on social media, Facebook, LinkedIn, Instagram,
Love
X.
it. All
So
right.
you can find us anywhere.
Everything, anything that's a social, you guys are on.
Yeah.
I appreciate it. You guys are with the times. Well, guys, if you guys are still listening, make sure you guys do subscribe, like, and comment, and check out some of the work that is being done in a space that sometimes people don't even like to talk about until it happens. Guys, my name's Ephraim. This is Michael. We'll catch you guys on the next one. Laters.
Thanks.